I need more men in here. Wally! Nelson! Oh, man, I need that chair. That chair to the earth. Pressure. Pressure on it. No. Let me see it. All right. All right, let me take a look at that. Oh, what the fuck was that? It's all right. Hold that down. I need a med pack now. Get outside! Get outside!
All right, so the hectic life of combat medic and how the things you have to deal with in life when you're a first responder. And so that's what I'm going to talk to you about over the course of the next 10 minutes or so. I'm going to talk to you about the March Principle, as you can see up here on the far left of the wall. The March Principle was started by the Committee for Tactical Combat Casualty Care, which used to be CLS, and now it's the military standard for first aid and first responder care. Right? All these different entities in the military came together and they said, how do we make first aid and first responder care better? Right? And because trauma medicine is a game of seconds and minutes, it was imperative, based on lessons learned from all the way back from Vietnam, it was imperative that the Army and the military in general came together and had this system. And so this March Principle came out of this committee. Right? And so over the course of the next few minutes, I'm going to talk to you about the principle itself and the precedents in which you treat trauma injuries, as well as some of the basic equipment associated with each of those steps or precedents of injuries. Okay? So I'm going to go ahead and bring up a presentation, a little quote here. All right, so leading preventable cause of death on the battlefield is bleeding from an extremity. Okay, that's from actually a quote from the Committee on Tactical Combat Casualty Care. The most recent actual conference was in 2012. They meet every 2 to 3 years, depending. That was the last one that was published, and then before that was 2010. So the March Principle. So what we start with is massive hemorrhage. Okay? And the things that we usually associate with massive hemorrhage that we, as first responders and people in buddy aid, is extremity wounds. Okay, and so that's why it's so important to know what equipment and to be able to quickly react to those extremity bleeds, because the person can bleed out so quickly from an extremity bleed, especially like in the femur, your femoral artery. The person can bleed out in like 2 minutes from a full sever of the femoral artery. So it's very important to know how to treat that. Next one, we have airway. Okay, so obviously after that first life-threatening bleed, person needs oxygen, person needs to be able to breathe. So you need to be able to get that person into a position in which they can breathe, okay, and make sure that that airway is clear. Right? The next one we look at is R, so respiration. When we think about respiration, we don't just think about nose, mouth, and throat. We also need to think about pretty much everything from the nose to the belly button. This all deals with respiration and your breathing. One of the biggest things that we have to look at with respiration is penetrating chest trauma, the things that can make a lung collapse, can get air into your chest, and that way lung can't expand, you can't get enough oxygen, brain dies, major organs die, bad news. Okay. Respiration, and then on to circulation. When we deal with circulation, we deal with all sorts of other major bleeds, but those that aren't necessarily life-threatening, those ones that don't have that big, bright, red arterial squirt. You know, those heavy, more, not as deep, those venous, the vein oozing bleeding, okay, a little bit dark red, that sort of bleeds. But we need to make sure that we cover all those up anyway, because fluid loss means blood pressure loss, and it also means temperature loss. And that's when we get into the last one, the H in March, which is hypovolemia, which also means hypovolemia meaning low volume or low blood pressure, and hypothermia, which means low temperature, right? All fluid loss equals temperature loss as well. So you need to make sure that you're keeping your patient covered throughout the entire process of care, as well as trying to stop all the bleeds that you can. because as soon as that patient, all the fluid that that patient loses means temperature that's lost. And there's a quote that I'll put up a little bit later on that talks about hypothermia and the survivability of a trauma patient. Okay, so the March principle: massive hemorrhage, airway, respiration, circulation, and hypovolemia, hypothermia. Okay, this principle is very important, but on top of the principle, you should also know what sort of equipment, at least the basic equipment, the most important piece of equipment that you guys or that first responders have access to for each of those steps in care. Right? And as we go through this, I'm going to show you just the basic piece of equipment that's actually going to be used in order to treat each of those tiers or precedents of injuries. So, from this study done by, it was actually a Colonel Krog, the Annals of Surgery, 2009, said up until this was up until, the study was actually completed in 2008 and then published in 2009, but it was an estimated 2,000 lives saved in war to date by tourniquets. 2,000. I mean, and you think about the ratio of numbers of casualties in the last 10 years of war versus, say, Vietnam War. I mean, it's a huge difference. We have had a greater precedence of life-saving techniques based on those lessons learned from Vietnam, World War II, Korea, all those previous wars that have been able to save lives up until this point. But at the same time, there's been a lot of people that, even in the early stages of this war, where a lot of techniques, especially tourniquets, weren't being used as prevalently. And so this is something that's been that lesson learned, and now we're actually getting to the point where it's just an automatic thing, and pretty much everybody's getting issued them. Okay. So when we talk about massive hemorrhage, first thing we think about is the tourniquet. All right. And so this is called the soft T tourniquet, and it's just a simple strap, an aluminum windlass. It's got a metal clamp. It's very sturdy. All right, and it's just as easy as putting on, and especially when you're initially doing your self-aid or buddy aid, looking to put it on a single bone rather than a double. Twisting it up, securing it, and then there's a little screw here, and then you can tighten it down, and it's just that easy. All right, so it's just a simple tourniquet, but a very important life-saving step. Okay, so massive hemorrhage. Next thing we go on to is airway. Airway is obviously very important, and one of the things that you may have seen before is the nasopharyngeal airway, NPA. And most of the NPAs nowadays are sort of not one size fits all, but they have this nice little donut on here which you can size it to whoever you're treating, okay? And so basically the way you size this is you just look, you take it from the tip of the nose to the earlobe, right? And that's how you measure it on your patient. And so for me, I've got kind of a bigger face, bigger head, and so this full size, this 30 size is what's actually going to be effective for me. Somebody with a little bit smaller face, a smaller frame, to be able to adjust it and then use it on them. And it's just as easy as putting this bevel right to the center, starting on the left nostril, right towards the middle of the nose or the septum. Insert it in. It's going to naturally follow the curve of the sinus, and it's just going to slide right in. And this helps keep your patient's airway open by going back far enough in the throat to be able to block the tongue from actually covering the airway. Okay, so NPA and airway. We go on to circulation. Respiration. A lot of things are covered in respiration. We take care of the airway with the NPA, and we want to talk about that penetrating chest trauma. We have chest seals. These are called halo chest seals, and these actually, you may have seen Ashman's before that had a little vent in them, a little one-way valve. These are actually found to be more effective pre-hospital by having no seal, right? And just because of the adhesiveness of it and the ability to just seal the wound during movement, these have been found to be much more effective. And are just, just an all-around great product. And they haven't sold a patent on these, so these are really good to use. So halo chest seals for that penetrating chest trauma, and always they come in packs of 2 because you're always looking for an entry and an exit point. Okay. We go on to circulation. Circulation is covering up all those bleeds, right? And so there we have a variety of things we can use. We can use something as simple as this Curlex gauze to wrap up to help with those field dressings that everybody gets issued or used to get issued. We have these ACE wraps in conjunction with gauze pad that we can use as well to cover up those bleeders. And we also have what's called combat gauze if you haven't seen it before, it's just a roll of gauze that's been impregnated with a clotting agent to help. So for those deep or really heavy bleeds that you might not be able to get a tourniquet around up in the groin or up in the armpit, that's what this was designed for, to get in there and actually help with the clotting and stop the bleeding faster, and then put more Acrylics and things like that on there, okay? And then you get into that hypothermia and hypovolemia. And hypovolemia, your tried and true, your IV. You've got your fluids, your tubing, and we have these saline lock kits, these prepackaged kits that a lot of people get now. That are great. They come with a constricting band, and this constricting band is also for securing the tubing. Comes with alcohol wipes. It comes with a covering dressing. Comes with your catheter, which is the hypodermic needle with the tubing over top of it, as well as hard needle and syringe. So it comes with a lot of all this in nice one little prepackaged container, so that way it just helps with all that extra equipment. And then for hypothermia, you always just want to make sure as you're treating the patient, you always want to make sure that you're covering them. So if you're working on one arm, keep the rest of the body covered. You have to go to the chest, cover as much as you can as you're working the patient. You try and keep as much of that temperature in as possible, okay? So knowing the steps of this march, knowing these basic fundamentals, that massive hemorrhage, that airway, respiration, circulation, and hypovolemia, hypothermia, and how to treat them with some basic equipment is very important for everybody to know, and especially with us and how, you know, the line of work we do and where we end up going. So that way you can help your friends come back a lot. Right? Thank you very much for your time. I appreciate it.